A lot of times we find it hard to believe that a child can possibly have sleep apnea. Usually we think of sleep apnea as a disease that affects someone who's in their 60s and overweight and snoring a lot and just very obvious signs of sleep apnea. But you'll be surprised that a lot of children nowadays are having signs of sleep apnea, and a lot of children actually have sleep apnea. So there's a lot of signs that a dentist specifically will look at that will show signs of sleep apnea or something called sleep disordered breathing or some other sleeping condition. First of all, if a child is grinding their teeth in their sleep, that is a really bad sign. This is one of the first things I check when I'm doing my dental exam on a child. If I see that those front teeth are really worn down and flat, and if a parent tells me that they hear them all night long grinding their teeth back and forth in their sleep, this is a huge indication that there is some breathing issue involved. Because a natural response for a child when their breathing is cut off when they're sleeping is to start grinding their teeth. And we have studies to prove that. So if you have a child and you see that that child is grinding their teeth in their sleep and you can hear them in the next room over, I would advise you to go to either a dentist right away or an ENT, an ear, nose, and throat doctor right away to get an airway examination. And also another bad sign with a child is if they are snoring. A lot of times we think it's super cute when we see a little baby or a little child sleeping and we hear them snoring. And the reason we think it's cute is because, well, first of all, it is cute, but second of all, we think snoring is normal. But from all the other things I've been talking about, we know that snoring is absolutely not normal. Normal breathing is something that we cannot hear. Normal breathing is silent breathing, in and out through our nose. If we see a child with their mouth open and they are snoring, that is another huge problem and another indication that they have either sleep apnea or some sort of sleep disordered breathing. And sometimes there are more subtle signs that we don't really pay attention to. Like if they go to sleep and they appear to be sleeping normally, but they are really restless in bed and the next day their sheets are kind of all over the place, that's another bad sign, and I would definitely get that one checked out as well. Another bad sign is if they have very large tonsils and adenoids. This is another thing that I check in my routine dental exam when I'm seeing kids. I'll have them open their mouth and say, ah, and I'll check their tonsils and their adenoids. If I see really large inflamed tonsils, then this might be another indication that they have a sleeping issue. And the reason is that this is all related. And breathing issues, and specifically mouth breathing, can cause issues like enlarged tonsils and adenoids. And also having these large tonsils and adenoids can be another contributor to sleep apnea. Even Dr. Christian Guilleminault, who is a sleep apnea expert, believes that mouth breathing will cause these large tonsils and adenoids. A lot of people wonder whether having these large tonsils and adenoids is what causes them to become a mouth breather, but we have evidence that it's actually the other way around. One reason is when people get their tonsils and adenoids removed, it is more of a temporary fix. So a lot of times children will go get their tonsils and adenoids removed whenever they go see an ENT because they find that they have very severe sleep apnea and they want to open up their airway as much as possible. So they remove those tonsils and adenoids. Well, what we know is that will work very well for a short period of time. For a lot of time, we did not want to do any long-term studies on tonsils and adenoid removal because we just thought it wasn't necessary. And I don't really blame them because in the first few months and first year after that tonsil and adenoid removal, we saw huge improvements and there's no sign of anything getting worse. So why would you keep doing studies for years on end? But luckily now we have more long-term research on removing tonsils and adenoids. And specifically, we have research that follows up 3 years and beyond. And we find that these tonsil and adenoid removals are not as successful. And these kids, again, are having these same issues of sleep apnea or some disordered breathing when they're sleeping. So what you gotta understand is, if you are getting your tonsils and adenoids removed in your child, just know that this is a temporary fix. And the reason is, this is not fixing the cause of the problem. And the cause of the problem, again, is mouth breathing. And I talked a lot about why this is the case in the first place in some of my other videos, so I'm putting a link in the description below where you can learn more about that. But in a nutshell, when you're a mouth breather, you're way more likely to get sick versus when you are a nose breather. When you're a nose breather and you're breathing properly, you're going to be a lot less likely to get sick, and you're going to be a lot less likely to get those tonsil and adenoid infections, and you're going to be a lot less likely to have sleep apnea. So the biggest thing you can do for your child is to make sure that they are breathing through their nose. Now, the last sign that a child has sleep apnea or some sort of sleeping disorder is they're showing symptoms of ADHD. Surprisingly, ADHD has the same symptoms as someone who is chronically tired or sleep deprived. If you look at the list of symptoms of ADHD and you look at the list of symptoms of someone who is tired, they're practically the same. And the reason is that we have a lot of evidence that a lot of the cases of ADHD are going misdiagnosed. I'm not saying all the cases are fake, but a vast majority of them can be attributable to not sleeping good. For example, in one study, they took 105 kids that were scheduled to get their tonsils and adenoids removed. But before they got their tonsils and adenoids removed, they had two things done. They had a sleep study, and they also got evaluated for ADHD by a psychiatrist. They found that 22 of those kids had ADHD. And after the surgery, they went back to the psychiatrist and got re-evaluated. And they found that after 1 full year, only half of those kids still had ADHD. And just so you know, based on the definition of ADHD, that is impossible. It is impossible to lose your ADHD after just 1 year because ADHD involves neurologic damage to the brain. So you're telling me that after just 1 year of removing your tonsils and adenoids, that half of these kids no longer had ADHD. The thing is, they never had ADHD in the first place. They were just sleep deprived. Now again, I'm not saying that all cases of ADHD are fake, but if your child got diagnosed with ADHD, I would be very suspicious of some sort of sleeping problem first. Now, if you didn't watch the full video, I'd recommend watching that. I'm putting a link in the description below where you can see that. And I also talk about how you can actually fix sleep apnea or even prevent sleep apnea in a child in that video as well.
A lot of people in the Northern Hemisphere, around March time, they have to do something called daylight savings time, where they move their clocks forward an hour. So essentially, they're losing an hour of sleep. Just losing that 1 hour of sleep opportunity does a lot of harm, and a lot of people don't realize this. For example, researchers looked at